And welcome to your program of choice at AIT, a platform where we focus on public health issues, challenges of women and children with a view to find lasting solutions. I am your regular anchor, Ushomowa Daniels. Our focus today is on cholera and the current outbreak. We'll be right back after the news segment. The need to include nutrition as a subject in the elementary school curriculum and to encourage the establishment of home and school gardens have been re-emphasized to address the challenge of malnutrition in Nigeria. This message is coming from participants at a two-day legislative engagement focused on improving nutrition in 13 focal states, including Lagos, Kaduna, Kebbi, Kano, Jigawa, Nasarawa, Benue, Enugu, Bayelsa, Gombe, and Cross River State. The event had as its theme, Prioritizing Nutrition, a Pathway to Human Capital Development.
Imagine a generation of Nigerians who have experienced malnutrition, probably of no fault of theirs, now arriving as adults in the future. That would be a scenario where the country could be at risk of a missed generation, a generation of people who lack the knowledge, the skills, and all the relevant factors that would be relevant to drive our economy and see us being a successful country.
We need to allocate more funding. We need to ensure that the funding that is allocated is released. We need to ensure that when it's released, it's spent and it's accounted for. And we need to increase performance on purpose to ensure that we achieve it. Emphasize on the importance of maternal nutrition. When the child is now born, we ensure that the child is breastfed exclusively for the first 6 months. You need to do it right because after the first early phase of development, if the child is stunted, it's difficult to reverse the impact of stunting.
Policies enhancement by way of legislators committing to review and strengthening existing nutrition policies in their states, increased budgetary allocations, and development of comprehensive state-specific nutrition action plans were some of the resolutions arrived at from the meeting.
I want all my colleagues from the various states of assembly, the 13 states that are here, to go back home in their peculiarity of administration, to be able to do what I've just said, that let them go and ensure that the issue that has been canvassed here is not just to be educated and clapping, is to ensure substantial implementation of what we have learned here.
Oftentimes, many Nigerians during emergencies stand by to look, while some busy themselves taking pictures to trend on various social media platforms, thereby wasting the first few minutes critical for survival if giving prompt response. It is to bridge this gap that the Health Emergency Initiative HEI is collaborating with partners here to train community members and other officers from different organizations.
We have trained over 95 persons, and they have been trained as TOTs, that's, as I said earlier, train the trainer, equipping them with the capacity to go through, step it down in their communities. And most of the deaths happen because bystanders do not have the basic skills of what to do when emergency happens. The little direction, support, tips from these health workers to the communities would change the narrative and the outcome of morbidities and fatalities associated with these cases.
A society that is well primed and healthy is more or less telling the nation to grow exponentially. And these people have been helping the government in ensuring that health for all is achieved.
When accidents happen on the highway, the likely agency you typically see would be the road safety people. And you would agree with me that if the people on ground don't know what to do, then why are they there? In addition to them keeping the roads safe, we are now saying that help us keep the victims safe as well in as little way as possible.
Road traffic crash victims that are vulnerable, When taken to the hospital, somebody can actually take care of them before they can reach their next of kin. The Health Emergency Initiative can be the intermediary to actually step into the case to assist these victims to the tune of a certain amount before the arrival of their family members or what have you.
Emergency do not knock on our doors. It can just happen and meet us at any place and at any point. And with the brain drain ongoing and the overwhelming medical conditions that flux into our hospitals, it is just expedient that we have a functioning first responders across every community. The basic thing that this just aims to do is to ensure that we have not just bystanders that knows how to snap pictures, but people that are concerned, genuinely concerned, and truly want to provide help to any case of emergency, at least pending when it gets to the hospital. Because most times, some of the persons that die when they get to the hospital did not just die because the condition was that bad. They die because the first aid that should have been given to them was withheld. Either because persons are scared or they don't even know what to do.
On the outbreak of cholera across 31 states in Nigeria, they called for more sensitization to avert an epidemic.
Now that there is a breakout of cholera, of course, we are extra careful. And the training ongoing, some of our men are also being trained. They are always on the road because they are on ambulances, they are on patrol. When these crashes happen, they get there first.
In this kind of outbreak we have, that is cholera, first and foremost, we try as much as possible to do a lot of campaign. Don't take ingested water. Boil your water. CV, those days our mother don't have a pure water, bottled water. What did they do? That water, wherever they fed, they will put it and use a sieve, plain cloth, because they were told. Then boil your water in this era. And I tell you, cholera kills.
Health Emergency Initiative, a non-governmental organization, is devoted to raising awareness about public health issues, provides financial support for road accident victims and other vulnerable groups. Parkinson's disease is a neurological disorder that makes part of the brain to degenerate, contrary to popular beliefs that it is common with people from ages 60 and above. More younger persons are now being affected.
You see somebody living with Parkinson, it's as if someone that have no hope. Yes, when some people saw you, they think that it's a special sin that you are committed or somebody that is cast with one demon from the village, not knowing that it's a sickness that somebody can have at any time.
The story of Deborah Ifeanyi and the challenges of stigmatization represents that of many Nigerians out there suffering from the condition.
Next to Alzheimer's, it is the fastest growing neurodegenerative disease in the world. From about 60 is when you're most vulnerable. But right now we're seeing a lot of people who are below the age of 60. We're having a lot of young onset Parkinson's, which is really under 40. And as I speak, we have 4 young women in our center who are under 40 and are living with Parkinson's. We have under 30 living with Parkinson's. Therefore, nobody should sit back and stigmatize or look at them and say, poor them. Poor them could be you.
The symptoms of Parkinson's disease include slow movement, pain, sleep disorder, dementia, and mental health crises.
It's difficult to get funding for a health condition that is not a pandemic because people keep saying, no, it's not sickle cell, no, it's not malaria, there are not that many people. And it is important that we support patients living with Parkinson's.
Be on the move. Don't stop because Parkinson's has happened. Life must continue going.
Although no known cause has been identified, family history and head injury have been attributed as major risk factors. The high cost of healthcare and essential medicines topped discussions at the 13th Annual Symposium of the Health Writers Association of Nigeria, EWAN, held on the 27th of June, 2024, with the theme, Dwindling Local Drug Production and High Cost of Essential Medicines, Rethinking Strategies for Growth.
Many Nigerians cannot even afford drugs today. Many people are now going to the alabos to go and take drugs. And some of these things, we have high rates of kidney diseases among Nigerians today. These are some of the causes of this disease burden. So the Health Writers Association now, we sat down and said, let us look at how we are going to bring some solutions to the problem of drug scarcity and drug cost in Nigeria.
Seeing multinationals like GSK, Sanofi, Aventis leaving Nigeria, is so painful. The exit of these multinationals has created a void in Nigeria in terms of broken supply chain. Okay, so anything that we need to do in terms of multi-sectoral, multi-stakeholders to ensuring that we bring back drug security and equally enhancing the capacity of the local players to ensuring that we move away from 70% importation, to 30% importation and having 70% manufacturing locally is very important.
API production is good, but are we going to produce all API? That is no. Till tomorrow, there's only one family in China that is producing folic acid, producing for the whole world. I remember when folic acid used to be very, very cheap. All of a sudden, the family switched it and the price went up. So we are going to produce APIs where we have comparative advantage. It means which product are we using most in this country and in the continent of Africa. And then government should put focus on those products. We can never ever produce all the APIs that we need. That's why, number one, I advocated for focus on starch as a common denominator. We already have the starch. How do we translate it to pharmaceutical grade, where it can be used for production of drug? That is important.
Issues around the cholera outbreak also came to the fore.
For me, cholera is a disease of poverty. At this time, in Nigeria, we're not supposed to be seeing this kind of outbreak. Let the government begin to do something about, providing safe water for the masses. And the masses, too, should learn to boil their water. People should boil their water. People should, before drinking, even if it's pure water, you can still boil it. So many things what we call pure water are not even pure in the first place. Even in the so-called bottled water, many of them are not registered with NAFDAC. So the best bet, my advice to Nigerians is for them to begin to boil their water, keep personal hygiene. For children, when they go to school, they should learn to wash their hands and all that.
It's quite unfortunate that we still be having outbreaks at this current age and time. But one thing we know that is certain, outbreaks would always happen. But in Lagos State, what we also know is the fact that there's a rapid response for every outbreak. And that has swung in place. And if you look at the trend, we would realize that the interventions are working.
Among the recommendations from the symposium include the need for government to fund the pharmaceutical sector, make health insurance compulsory, close down on open drug markets to reduce the circulation of fake medicines in the country, and to chase growth instead of inflation.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Whatever you need to know about cholera, the outbreak, and how to protect yourself and loved ones, we bring to you on this package. This is Oworoshoki community in Koshofe local government area of Lagos State, one of the communities where many cases of cholera have been reported since the outbreak.
With the highest number in Lagos Island, followed by Koshofe, Lagos mainland, Etiosa, Alimosho, and the lowest impacted were Ifakojaye, Amuodofin, and Ibejuleki. Many children came down with cholera, many students, lots of traders, and artisans. And those were the predominant cases. And these we suspect are people that are in crowded areas or in institutions. This is prior to reopening of the schools where we did not have intense public health information. We work in concert with multiple agencies and ministries, in particular the Ministry of Environment and Water Resources, the Ministry of Education, the Ministry of Information and Strategy, Physical Planning and Agriculture. And we're all working together in concert to curb the transmission of cholera through our communities and into our citizens.
The dirty nature of this environment speaks volumes about the ongoing outbreak.
Nigeria seems not to be ready to control this disease. If you look at the NCDC, the report of the NCDC, the first two ways of prevention of cholera they gave was, number one, access to potable drinking water. And it is the responsibility of government to provide this. The second is waste disposal, proper waste disposal. Do we have proper waste disposal? Disposal in Nigeria? No. People come to your place. In fact, if they come to collect the waste on your street, even in your compound, you see those wastes being dropped, in various places, and those wastes being droplets of those wastes can cause, serious health issue. In the 70s, in the 80s, in the 90s, we used to have public toilets in public places. Today, we don't have them again. So people can defecate anywhere. They defecate in the river. They defecate in every corner of the society. And so, what do you expect?
The absence of potable drinking water is also a problem here, with no government-owned health facility nearby.
When the rain falls, that is where we get a good water. That is only where we get good water. But if we are on a dry season, there is no good water at all. We just drink anyhow water we see. But we want government to help us.
The message to the people, to the federal government, state government, and local government is that they've abandoned us here, and it shouldn't be so. We want their intervention in many things in this area. Thank you. Like a good drinkable water. We need water here. Before we can get a very drinkable water, we normally go far distance before we can get any water to drink. And not every time. We may say, okay, they have a good water there now. When we get there, they will say no water again, because it's only one or two places that we can get that drinkable water just to manage ourselves. But most of the time, we do normally buy pure water. They normally bring pure water from many companies to this place.
The hospital we had is only the one at General Hospital at Ibagada. That one is far from us. If government can even apply and even secure that General Hospital for us, at all, we will be happy.
The provision of free medical treatment by the Lagos State government, according to experts, is commendable to effectively manage the situation, but adherence to necessary preventive measures remain the best option to avert further spread.
Yes, cholera is actually very deadly. Like here in Lagos, we've seen cases where up to over 20 people have died because of cholera. So it's not something we joke with. But the key advice here is once one has diarrhea, watery stool, like rice water, the best advice is move to the closest health facility. The gracious thing is that government is already working very hard to ensure that services are available, treatment is available, and I understand it's also free in most of those health facilities, public health facilities. So people should take advantage of this and not wait and do self-medication. Prevention is actually better than cure. And what I'm telling Lagosians is that we should watch what we eat. We should maintain proper that which is water, sanitation, and hygiene practices. That's very important. We should watch the source of water we drink. It has to be clean, potable water. Then, of course, one can get this from the things we consume. It can come from beverages that are prepared from water that is not potable, that is not clean enough. It can also come from the things we touch, So, and this rainy season is one of those seasons where it's actually very, very common, because some of the fecal waste that are out there, the rainwater and the flood flushes it into some of those sources that we come in contact with. So at this stage, every Lagosian, everyone in Nigeria has to maintain very high level of hygiene.
Our future, we say, is in our hands. And if we must take our future into our hands, the health
of our future the health of our bodies is very paramount to our future. And so we must wash our hands. We must ensure that our environment is clean. We must ensure that our community is safe from any ill sanitation practice that can actually mar the health and the well-being of the community. It's time for us to practice hand washing as a behavior. It's a behavior that comes naturally, and then make sure that we keep our communities clean. We ensure that there's access to safe water, clean water, and if we have a role to play in being our neighbor's keeper. If our neighbors do not have this kind of knowledge that we have, we need to share that knowledge and ensure that we promote together a resilient community where cholera would not take hold of us.
Cholera is an infection of the small intestine by specific bacteria. It spreads through contaminated food and water, resulting to severe diarrhea and dehydration.
We did have some very severe cases that we were able to rescue. Very severe dehydration at the infectious disease hospital because their kidneys had shut down from the severe dehydration, and at that facility we have access to renal dialysis, so we're able to wake the kidneys back up with renal dialysis and rehydrate them. And those are the kinds of cases that we still have on admission because they were very, very severe, and we're able to rescue them from dying. As I said, most of the patients that did die were either brought in dead, or by the time they came in, they were so severely dehydrated we could not rescue them, which is why we reiterate that once you develop symptoms, please do not stay at home. While you're at home, use oral rehydration therapy and present yourself to the nearest facility, ideally a public health facility because your treatment there will be free. But if you go to a private facility, they will first of all give you first aid treatment, and then you can request to be referred to a public health facility where your treatment will be free. So only those that had severe disease and we had to do over and above rehydration are still left on admission across some of our general hospitals, and in particular infectious disease hospital in Yaba, where we had to do some renal dialysis to save some of these patients' kidneys because of the intense dehydration.
To reduce the spread of foodborne diseases, the Lagos State government has also promised to unveil the Safe Plate and Beverage Initiative so that everything people consume are certified okay.
About a handful of patients described that they had consumed some street beverages. The majority of patients talked about other forms of access to drinks. And I'd just like the citizens of Lagos, all the residents of Lagos, to rest assured that the government is doing everything to make sure that this does not become a problem. And you can actually relax and have confidence in us that we are on top of this situation and you need not panic. Please go around your business as normal, but just adhere to the safety recommendations and advisories that we have given you from the Ministry of Health, from the Ministry of Environment, from the Ministry of Education, from the Ministry of Agriculture. And we are stepping up our regulatory activities to make sure that we can guarantee that what you eat and drink in Lagos will be as safe as possible.
Open defecation is very common and it's unfortunate. Very soon we see all around Lagos brand new public toilets.
Some symptoms of cholera include watery diarrhea, vomiting, abdominal pain, and fever. If you are just joining us, it's Health Affair on AIT, and next on the program is our nutrition segment, that aspect of the program that focuses on eating right to stay healthy.
Egusi seed is a good source of potassium and calcium, minerals that regulate blood pressure. It is also a rich source of magnesium, phosphorus, iron, and zinc. And just like all plant foods, egusi is naturally cholesterol-free. Melon seed is a popular food crop in Nigeria and other African countries that comes with lots of health benefits which are vital for children, young and old, men and women. Melon seed is popularly or locally called egusi, and it's fortified with essential minerals and vitamins which promotes eye vision, improves the skin and hair, and other numerous benefits it offers. Here are some health benefits of melon seed, which is good for the human health. The vitamins in melon seed provide exceptional benefits to the human body. The presence of vitamin B1 thiamine and vitamin B2 riboflavin makes the fat and oil in the body to undergo the process of metabolism and is also good for improving appetite. The vitamins such as vitamin E as well as others help in improving the skin and make it stay healthy as well. And these vitamins in most cases are used in the production of skincare products such as soap because of its benefits to the skin. Egusi seed contains alpha-tocopherol, which does not only act as an antioxidant, but also as a vitamin E, as it helps in improving the skin and prevents anti-aging by reducing wrinkles, dry skin, and others, and is used for various. Egusi seed contains alpha-tocopherol, which does not only act as an antioxidant, but also as vitamin E, as it helps in improving the skin, prevents anti-aging by reducing wrinkles, dry skin, and others. It's also used for various dermatology purposes. Owing to its antioxidant properties, it also helps to prevent cells from damage due to the oxidation process in the body, which helps in the prevention of ulcer and other health conditions which are caused by the oxidation processes in the body. Its content of dietary fiber is also good for the body due to its ability to aid digestion, thereby preventing any form of a digestive disorder such as constipation and irregular bowel movement. Vitamin A content in egusi, as well as the oil, makes it good for consumption because of its function in the improvement of eye vision and more. Its properties as anti-inflammatory food helps to prevent swelling in the body and reduce any cause of inflammation, especially that which is linked to depression. Egusi also contains saturated fat, and that presents the need to eat with caution and the right way. Egusi soup is rich in oil, but most persons will fry the egusi with so much oil that you can scoop and prepare another soup. You don't need so much oil to prepare your soup.
On our clinical segment, we give you tips for healthy living.
Harmful alcohol intake damages important organs in your body, such as the heart, liver, and pancreas. Harmful alcohol intake also increases the risk of injuries, violence, and unhealthy sexual behaviors. Common alcoholic beverages include the home-brewed drinks, burukutu, pito, palm wine, ogogoro, and alcoholic drinks manufactured in the industry. It is recommended to avoid harmful alcohol consumption. Some current studies are in favor of complete abstinence from alcohol intake. Adopt lifestyles that keep you free from harmful alcohol intake.
This I'll wrap it up today. Thanks for spending your time with us. Let's do it again same time next week. I remain yours truly, Ushuomowa Daniels. Please keep staying safe.